I have that memorized. Okay, cool. Screen share. Alrighty, back in action. So anatomical position is used to describe the body parts and the relationships between the body structures. So the body is always considered to be an anatomical position. So when we're talking about anatomical position, you really want to take note on this. Also, by the way, I have a skeleton. I got it for my 21st birthday. That's how much of an anatomy nerd I am. So we'll be using him throughout the semester. If you live at the Vistas, you can actually see him out my window, and I dress him up for seasons and stuff. So he's in a Texas State shirt right now. So anatomical position. These are the main things I want you to know about it. Palms are forward. Palms are forward in anatomical position. So if I were to post a picture or anything like that, that is not anatomical position. Palms are forward in anatomical position. You are standing erect, which just means you are standing straight up. You're not like this, or like this, or like, you know, a hip out. You're erect with your feet together and your toes pointing forward. So palms forward, toes forward, standing erect. Yeah. One more time. Palms forward, toes forward, standing erect. That is anatomical position. Very, very, very crucial to know that, because anytime we ever talk about any structure or anything about the body, we're referring to it in anatomical position. Sorry, I look really sweaty. Go back to the non-sunny view. Okay, so now we're gonna look at the planes of the body. So we can break it down into 3 planes. I'm not going over oblique because it's very rarely used. So these 3 right here and the 3 in the picture are the main ones we're gonna wanna know. So first we have the sagittal plane. It divides the body into left and right. These also don't refer just to the body. They could refer to a finger, you know, dividing the finger. And, you know, it'd be an anatomical position. So dividing the finger in left and right, dividing the mouth left and right. But just in general, we can think of dividing the body. So sagittal is dividing left and right. The trick I always use here, because I used to always forget sagittal, is whenever you have a stroke, which hopefully, you know, that doesn't happen, but if you do have a stroke or know someone who's had a stroke, normally what happens is one side of their face loses muscle control, so it kind of sags. So like if they're doing, like if they're trying to raise their eyebrow, it would go up on that side, but not that side. So you can think either the left or right side will sag if you have a stroke. So sagittal, left and right. Then we have the frontal plane. Obvious, it divides front and back, but do note that you may hear it called the coronal plane. Frontal and coronal are used interchangeably. So I think in lecture you'll probably hear it coronal. So frontal dash coronal is front and back. Makes sense. You can see that here, front and back. And then lastly, we have transverse, which divides top and bottom. Is anyone, hang on, let me pull up my camera again. Is anyone taking med term right now? Cool. All right, so I might ask y'all for assistance throughout this semester because I haven't taken med term for like 3 years now. But I think trans means across. So you can think dividing across the body, so up and down. So again, sagittal, dividing left and right. Frontal or coronal, dividing front and back, and then transverse, dividing top and bottom. Oblique, we're not going to go through that. It would be like a diagonal cut through the body. So those are our body planes. So I'm not going to quiz y'all on this. It's just good to, you know, have for reference in case, you know, you ever hear someone say something, or if I ever say something and you're like, wait, what is that? You can go here on this slide to look at this. So I'll just quickly go through it. So these are the anatomical terms for our body's landmarks. So, and currently we're in the anterior view, which we'll get to the different body terms in a second, but anterior means front. So these are all the ones in the front. So nasal is nose, y'all know that, oral mouth, cervical is neck, axillary is armpit. You might not know that one, but I'd get used to hearing that. Axillary is armpit. You can think whenever someone is has bad BO coming from their armpits, they need some axillary armpit. Mammary is breast, like the mammary glands. You can think like ma'am, like ma'ams have breasts. I don't know. Brachial is your upper arm, or generally just your arm. Just because we're thinking of the anterior view, it says upper, but brachial is just the arm. You can think like you break your arm. Also, like you get, never mind, that's not a good trick. I don't want to confuse them. Antecubital is the front of the elbow. So whenever you get your blood drawn or anything, you get an antecubital injection. So that's like right here. Antecubital is where they draw blood and stuff like that. And again, I'm not quizzing y'all on this, so just for reference. Abdominal, abdomen, stomach area. Antebrachial is the lower arm. Brachial just in general arm. Carpal is your wrist, so like carpal tunnel. Carpal is wrist. Manus is hand. I've never heard anyone say that, so you won't ever hear that. You will never hear manus as hand. You'll just hear hand. Digital are fingers. You will hear the digits. So digital or digits are our fingers. Pubis is the genitals. Makes sense. Pubis, puberty, things like that. Pubic hair. Crural is the lower leg. Never heard that. Tarsal is the ankle. You will hear that. Your tarsal bones, your carpal bones are your wrist bones. Your tarsal bones are your ankle bones. Orbital is the eye socket, so the orbit. Buccal is the cheek. You won't hear that much, maybe whenever we get to like digestive or something. Mental is the chin. You won't hear that much, but it is good to know. You'll hear it a little bit. Sternal is the breastbone. This bone right here is the sternum, so that's the breastbone. Thoracic is the chest. That is one of the body cavities we'll be looking at, so you're definitely going to want to know that. Thoracic is the chest, but we'll get there in a second. Umbilical is the navel, so your belly button, umbilical. Inguinal is the groin. You'll hear that maybe, but I mean, not super important. Coxal is the hip. The hip bones are called the coccyx or the coccyx. So that's the hips. Patellar is the anterior knee, so the front of the knee. Y'all probably know the patella is the knee bone. And then pedal is foot, or pedal, however you want to say it. You can think like you pedal a bike. So the posterior landmarks, so these are the back landmarks. Otic is ear. Occipital is the back of the head. We'll be looking at a bone called the occipital bone. Vertebral is our spinal column, so the vertebrae. Dorsum is the back, so the whole back. Lumbar is the lower back. Sacral is between the hips. Gluteal is your butt. Perineal is the space between your anus and genitals. Femoral is the thigh, so whenever you hear about the leg bones and stuff like that, you'll normally hear like femoral. Whenever we look at the arteries of the legs, the femoral arteries, whenever we look at all that, you'll hear femoral for leg. Sural is the calf, never heard that used before, and then plantar is the sole. So again, I won't be quizzing you on any of these. You don't need to know them. They're just good to reference. And if I ever say, the thoracic region, if you don't, just go back on this slide and check it out. So now we're going to look at our directional relationships. So these are very important, and these will show up on lecture exams too. So I'm going to have to get up to do this. Normally in class we'd play Simon Says for this part, but can't do that sadly. So anterior is towards the front of the body. Let me turn this slide on real quick. So anterior is the front of the body. Posterior is the back. So you can think like post means like back, so like post, back, anterior, front. Medial and lateral. So medial is towards the midline of the body and lateral is towards the sides. So for example, you have two bones in your lower leg. So we have two bones in the lower body. We have the tibia and the fibula. So the tibia would be medial and the fibula would be lateral because medial is closer to midline, medial, midline, lateral is farther from midline. You can do the same thing with our fingers. This would be this one compared to this one, this would be what? Medial because it's closer to midline. This one would be lateral. Same with the bones in the arm. We have two bones in the lower arm. This is medial, this is lateral. So medial and lateral will show up a lot when we get into the skeletal system. So you're going to want to know those two, medial and lateral. Then we have superior and inferior. So superior is closer to the head, inferior is closer to the feet. So superior is top. You can think like your boss is your superior, so they are top, and inferior is bottom, like you're inferior to your boss. So superior top, inferior bottom. So like and you can use that describing things like my nose is superior to my mouth is inferior to my nose, my arm is superior to my legs are inferior to my arm. So that's how you'll hear those terms used. Superficial and deep. So superficial means towards the surface of the body, deep means closer, further in the body. So like whenever we look at the skin, we'll see that there's 3 layers of skin. So the top layer would be superficial because it's the top, and then the bottom layer would be the deep. So yeah, superficial, deep. And then proximal and distal. Proximal is closer to the trunk and distal is away from the trunk. You'll only hear these referred to when you're comparing 2 parts of the body. So like my bicep is proximal to my, let's see, let me think of an example that's really clear. So like my hand is distal to my shoulder or elbow. My elbow, it's hard to do over camera. So, sorry, my cats. So my hand is distal to my elbow, so it's going that way. My elbow is proximal to my hand. I won't quiz you on that too much because it's kind of complicated, but distal just means going away, proximal means coming in. So don't get too stressed on those. I'm going to be writing those down. Okay, so one more time, anterior front, posterior back, medial midline, lateral away from midline, superior top, inferior bottom, superficial is the top layer, deep is the inner layer, and then proximal coming closer to the trunk and distal farther away from the trunk. So now we're gonna look at our anatomical movements. So if you'd like, and I think it would be beneficial, go through these with me. Try to get these down. We'll also be seeing these whenever we get to the skeletal system. So these will be something you're quizzed on twice, and they show up on lecture exams. So we're gonna start with flexion, extension, and hyperextension. So flexion is decreasing the angle of a joint. So we can think of our wrist joint. So here's our wrist, and whenever we decrease that angle, that is flexion. Extension is just returning to anatomical position. So extension is increasing the angle or just returning to anatomical position, And then hyperextension is moving it beyond its regular. So with that, that's flexion, extension, hyperextension. Same with like the knee. So like the knee, this would be flexion, extension, or extension, because anatomical position, and then like if, my knee just popped. If you're double jointed, you can hyperflex. Can anyone hyperflex their elbow? Because this would be flexion, extension, and then if you can hyperflex it, like some people can, it's when it's like double jointed and it can do that. Anyone? Nope. All right, cool. And also I can only see like 5 of y'all at a time. It like switches every now and then. So if you like are waving or anything, I'm not ignoring you. I can only see a few amount of people at a time. So yeah, flexion decreasing, extension increasing, and hyperextension super increasing. And you can think of the arm as an example. So flexion, you're flexing your muscle, flexion, extension, and then if you're double jointed, hyperextension. Cool. Alrighty. Then we have abduction and adduction. So abduction is, come back up here. Abduction is movement away from midline. So like abduction, adduction. So you can think abduction, you're being abducted. So you're being taken away from midline. Adduction, you're adding to midline. So you're adding to the body. So abduct, you're moving away. Adduction, you are moving towards. In the orthopedic and sports world, you might hear it called abduction and adduction. So AB is the abduction away, adduction towards. Abduction away, adduction towards. So those are pretty easy with the trick. Then we have dorsiflexion, plantar flexion, and oh, there's another one over. I guess we're going over it. So dorsiflexion is whenever you do this, and plantar flexion is when you do that. So you can think like planting my foot on the ground, plantar flexion, or dorsiflexion. I don't know how to make a trick for that, but plantar flexion, you're planting your foot down. Dorsiflexion, you're pointing your foot up. Then we have inversion and eversion. So again, these are looking at the foot. They can be looking, this one can be looking at the hand too, but you'll primarily hear it as the foot. So inversion is moving the foot inwards. So inversion. Eversion is moving the foot outwards. So inversion, eversion, inversion, eversion, inversion, eversion. So you can think moving in, inversion, moving out, eversion. Then we have medial rotation and lateral rotation. So medial, again, is coming towards midline. So medial rotation, lateral rotation. Lateral is sides, medial is midline. So medial rotation, lateral rotation. So you can kind of do it with the leg too, like your legs like that. Medial rotation, lateral rotation. Medial, lateral. So that's what they're talking about there. And then circumduction is just like, you know, doing that, you know, any type of like circular movement is circumduction. So circumduction. And then we have pronation and supination. So this is looking at the palms. So pronation is this, supination is this. So a way to remember that is supination. You can think you're holding a bowl of soup in your hands. So your palms would be up. You don't hold soup on the top of your hands. You hold it on your palms. So supination, or you can think like, what's up? You don't go like, what's up? You go like, what's up? So supination, pronation. Supination, soup or sup, and then pronation, down. Okay. Then we have elevation and depression. So these are looking at the scapula and the mandible. The scapula are your shoulder blades. So these two guys right there. And then the mandible is your jaw. I won't be like testing y'all or quizzing y'all on that yet, just to know. So elevation would be shrugging your shoulders up. Depression would be shrugging them down. Elevation, depression. Depression, elevation. Elevation. Then we have protraction and retraction. So this is protraction, retraction, like you're retracting backwards. Protraction, retraction. You can be like you're reaching for something. I don't know. Same with the jaw. Protraction would be, and retraction would be, you can't really retract it that far, but so pro, like you can think like, I don't know, like you used to be a pro athlete and now you're not, so you're like just like, I don't know, just little silly tricks can help sometimes. And then I won't quiz y'all on these, I'll just tell y'all them. I've never heard this in any of my other classes. Radial and ulnar flexion. So the two bones of the lower arm, we have the radius and the ulna. We'll be going over that in the skeletal system, radius, ulna. So radial and ulnar flexion. Radial would be like moving that way. So if I was like waving my hand to someone, radial would be like going like that. Ulnar flexion, radial flexion, ulnar flexion, radial flexion, ulnar flexion. You can also look at abduction of the fingers. So abduction, adduction, abduction, adduction. So like if I were to put a picture on the quiz of like someone waving, like, or no, I won't do that. No, I won't put any of these on the quiz. But yeah, so this would be adduction of the thumb, adduction of the thumb, abduction, adduction, and then I don't know what opposition is. I guess it means like touching. Y'all won't see any of these. So here's just kind of an overview of everything we looked at. Anterior is front. You might hear it called ventral too. If you do hear it called ventral in lecture, I always think like whenever you always vent from your mouth. So ventral is the front, and then dorsal is the back. Like you're a fish and you have a dorsal fin. And then proximal, you can see here coming towards midline, distal going away from midlines. Medial is like the mid part, lateral is the side part, and then superior is the top, inferior is the bottom. So definitely like go through those, sometime this week. Just write down the names, don't write down the definitions, and just work through them on your own. I remember when I was studying for this lab, I went into Alkec and I got a whiteboard and I wrote down all the ones I needed to know, and I kept going through them, and when I'd get it down, I'd like cross it out and go through the ones I didn't know as well. So now we're gonna look at our body cavities. So first we'll start with the dorsal cavities, so the back, the posterior cavities. So we have the cranial cavity, very basic. And how I would ask y'all this on the quiz is I would like put a picture just like this, and I would, have a line going to a certain cavity, and I'd be like, label that cavity. And it would be probably multiple choice. That's how you can, this is more of a labeling thing. So here is the cranial cavity. Makes sense. It's the cavity that holds our brain, our cranium. So that one's pretty simple. Then we have the vertebral canal or vertebral cavity. So just the vertebra, your spine. So that's the vertebral cavity. And those make up the dorsal body cavities, but I'm not going to ask y'all, just be able to label. Then we have the ventral cavities, so the front cavities. So first we have the thoracic cavity. This is our chest cavity. You really need to know that. It comes up a lot. It comes up in skeletal, muscular, respiratory, all of those. So definitely want to know that thoracic is your chest. Thoracic, chest. Inside the thoracic cavity, you don't need to write this down, just, to picture things, are your lungs, your heart, your trachea, your esophagus, all those things right here in the chest. Then we have the abdominal cavity, so right here. And dividing the two is the diaphragm. So there's a muscle right here called the diaphragm. And I do want y'all to know that. The muscle that divides the thoracic and abdominal cavity is the diaphragm. So the diaphragm is this muscle that moves when we breathe. So you take a breath in and the diaphragm goes, and then when you breathe out, it goes. We'll look at that when we get to the respiratory system, but that's the one right here, dividing the chest cavity from the abdominal cavity. So that's the diaphragm, one of the two muscles used for respiration. But again, we'll get there. You don't need to know that part. And then lastly, we have the pelvic cavity, which is the pelvis. So where, the genital organs, vessels, the hips, all of those are contained. So one more time, cranial, the brain, the cranium, vertebral, the spine, thoracic, the chest, abdominal, the abdomen, contains our stomach, liver, intestines, things like that. And then the pelvic cavity, the pelvis. So those are pretty, they make sense. So now we're going to look at the abdominal regions. I don't believe I test you on this or quiz you on this. I need to go review the quiz. I'm not going to put this on here because it's really not that important. But I'll go through it. So let me sit down or kneel. So we have the right upper quadrant. So makes it, this is important. So whenever we're looking at right and left for the human body, it's for the patient, not from your point of view. So it's hard to do over Zoom because I don't know if it inverts my camera. So like my left is not the patient's left, that's their right. So if you're the patient, your left is the doctor's right. I just made that so confusing. I am so sorry. Let me word this correctly. So whenever you're talking about left and right, you're talking about the patient's left and right, not your view of left and right, but the patient's left and right. So just write down left and right from patient's point of view, not the doctor's. Whenever we get into like the cardiovascular system, that'll start to make more sense. And I think your lecturer should explain that. But yeah, so you would look at this picture and be like, that's not the right side, that's the left side. But if we're looking at the patient, that's the patient's right side. So even though it says right upper quadrant right there, that is the right upper quadrant for the patient, even though on this picture it looks like it's the left. And I'm also really bad with my left and right, so I always have to do the thumb thing. So sorry that I made that confusing. So we have the right upper, the left upper, the right lower, and the left lower. And the only reason you would use these if you were going into like gastrointestinology or something, like if someone is having, right upper quadrant pain, well, their liver's in there, their upper small intestines in there, so that's what that would be used for, ESS. And then the rest of the majors I heard, not too important. So that is it for our lecture today. Don't log off yet. I have a few more things. So you really need to drill this information in. These basics will continue throughout the rest. It is basic stuff, so you don't need to be really stressed about studying for it, but you do want to, drill it into your mind. Be comfortable with the terms. Don't have to be like, Abduction, wait, let me think about that for a second. Oh yeah, that's going away. Try and get comfortable with it. Like abduction, away, medial, inner, lateral, sides. You know, get really comfortable with these terms. You know, I recommend finding ways to stay consistent in studying this information. So whether you make note cards, what I did when I was in this class is I would make my own PowerPoints. So I would make a PowerPoint after each lab and I would put little boxes over the key terms. And then I'd go through the PowerPoint and try and try and see if I knew the terms. And the ones I didn't know, I would like put a star on. The ones I did know, I'd put like a check on. So you make PowerPoints, you can do outlines, you can do drawings, whatever you need to do. Start a binder, start a folder, start, you know, something to keep all of this organized and intact. I also think you should, you know, dedicate maybe a day or a time to study for this. You know, a lot of us probably don't have Friday classes. Get it out of the way before the weekend comes. What you'll see is our assignments, our lab report, and anything else that we have for the week is due on Sundays at 11:55 p.m. So get it knocked out on Friday so you can enjoy your weekend. Get it knocked out on Tuesday night so you can enjoy the rest of the week. Whatever you need to do, stay consistent in it, because if you get behind, it is so hard to keep up. So don't get behind. So what do we have due? Dun, dun, dun. So it shouldn't say tomorrow before lab begins. Again, this was from the summer session when we have lab every single day of the week. So this, I'll edit it real quick. So this will say, your first lab report is due Sunday at 11:55 p.m. On tracks, you could set it to 11:59. I'm having trouble finding out how to do that on Canvas. It's just saying 11:55 for me. So 11:55, midnight, is when your lab report is due, and I'll go over what the lab report is. And then you'll also have your first quiz on Tuesday. So again, the quiz is the first 15 minutes. So from 5:05 to 5:20 is when our quiz is. So be sure and study. So if you're ready, and this isn't accurate either. If you're ready, we're gonna go through some important things I would like you to know for the quiz. So star these things, just jot it down real quick, whatever. What I'd recommend for the rest of the semester is either printing these slides out or having them pulled up on your laptop, because they will be really good to reference. So I definitely want y'all to know the difference between anatomy and physiology. Super easy. Don't waste a bunch of time studying that. When I took this lab, I spent way too much time studying the stuff I already did know because that's fun and you're like, oh, I know this. And then like not studying the stuff that I didn't know because I was like, this is hard. But if you study the stuff you do know, you waste your time. So, you know, just have that in mind. Don't focus on that a lot. You know, just know that like prolonged loss of homeostasis is how everything dies. That's just pretty basic. Definitely know the anatomical position we talked about. So palms forward, toes forward, standing erect. Know the three planes, sagittal, frontal, and transverse. Those are pretty easy to remember. Know your directional relationships, specifically anterior, posterior, medial, lateral, superior, inferior, superficial, and deep. So all of those except for proximal and distal. And again, these aren't hard terms. So I know I'm saying a lot of them, but once you study them 1 or 2 times, they make a lot of sense. No flexion, extension, hyperextension. If you need more, just look up on Google flexion, extension, hyperextension. You'll find more examples. Definitely no abduction and adduction. That one's really easy if you think of abduct and add. No dorsiflexion and plantar flexion. Again, pretty basic. You plant your foot down. Plantar flexion. No inversion and eversion. So inversion coming in, eversion going out. Nah. Pronation and supination and pronation. So again, supination, you're holding a cup of soup. Pronation, you're putting your hands down. Supination, pronation, know those two. Circumduction, too easy. We're not gonna study that one. Nah, I'll leave those for biomechanics. You'll study that in biomechanics a lot. Nah. All right, know your cranial, be able to label, if you saw a picture like this, be able to label like the cranial cavity, the thoracic cavity, the abdominal cavity, and the pelvic cavity. And then again, I want you to know that it's the diaphragm separating the thoracic and the abdominal cavity. So know 1, 2, 3, 5 cavities. And again, they're pretty, make sense. Quadrants, don't care about. So yeah, there's 10 questions on the quiz, but some of them are like multiple, like matching or whatever. It won't be bad. A lot of people may make a bad grade on the first one just because they're not used to it yet, but I think it should be pretty easy. So study what we just went over. Look at the PowerPoint. If you have the manual, you know, flip through it. And I will start the GroupMe. I'll send y'all an email with the code and you just need to join it. Please join it because I will send out announcements in there and I might forget to send out another announcement. So definitely join the GroupMe. And if you don't have like a smartphone, you can access it online too. So yeah, study up. Let me go over the lab report really quick. The lab reports will be different every lab. This first one's gonna be one of the most boring ones. All right, let me get back to Canvas. So if you go to your modules, here we are, lab 1. I have all the labs loaded, but I need to update the dates. So here we are with lab 1. So you'll go down. Here's the PowerPoint if you want to reference it. Here's the reading from our manual. The activities posted on here, we won't be really doing those. I just had to put them for the other IAs. And then here is lab report 1. You also have some extra credit this week. Introduce yourself. I've seen that a few people have already done that. Go y'all. And so I'll go over both those. So first we'll go over lab report 1. So what you'll do is it's a 250 word, Word document, or you can type it in the text box here. Just in 250 words, you can make it into a paragraph. You can bullet point it. I don't care about the format. So you can do MLA, you can just do bullet points, whatever. So make a list of the study methods you'll use to learn the materials in the lab. So you can write like, I'm going to make note cards. I'm going to do this. I'm going to do that. I'm going to study at this time, whatever. And then make an outline of the important topics you learned in lab today. So again, that can be bullet point. You can write like abduction and then the definition. Don't copy and paste it. It needs to be like put into your own words. So don't go and copy my PowerPoints and then type it. I will be reading through these. Also, on these lab reports, if you have a memory trick that I didn't use, highlight it. put it in there somewhere, highlight it, because I always love finding new memory tricks. So that would be really cool if y'all did that. So make sure it's a Word document or the text entry on Canvas, and it's due Sunday at 11:55 p.m. I need to change that. And so that's the lab report, pretty easy. That's your homework. So then we have some extra credit under discussions. Here's the introduce yourself thing. So this will just be a way for us to like go back and reference it in case like someone got in late, or if I kind of like forget what you said. Go introduce yourself, do your name, your major, what year you are, and then your career goal idea. And then just add some fun facts, like if you have pets, hobbies, favorite class you've ever taken, favorite activities, places you like to go in San Marcos, whatever. And then I really want y'all to add a professional profile picture to your Canvas account. So like, this is a great picture, great pictures here. Not like an iPhone picture with your cat halfway in your face. Like, I need to be able to see your face very well. So like, that's what I see on Zoom whenever y'all don't have your cameras on. So make sure you like add a profile picture. So yeah, that's extra credit. I haven't decided how many points I'm gonna do on that, but yeah. So that's about it for our lab today. Sorry it went kind of long. We had to do those intros. Next week it won't be that long. Do I have any questions? Cool. Well, y'all are free to get off. I'll stay on in case anyone, wants to say anything. So nice meeting y'all.
For the quizzes, are they going to be like on Canvas, or how will they like be formatted?
They'll be on Canvas, and they'll be 15 minutes and 10 questions.
Okay, thank you.
How do you turn stuff in on Canvas? Like you said.
So yeah, I'll definitely show you that for sure. So you go to Canvas, there's the assignments tab, and you go to like the lab report, which I haven't opened any of this till today. So this might you might have not seen this before. Let me switch over to student view. It won't let me do student view for some reason. So there will just be like, let me go home, student view.
Oh, is it the submission and wait.
Yeah, I think so. So assignments, lab report 1, and then there should be like some button. I don't know why it's not showing for my view. But yeah, email me if you're having trouble with that, but there should be some type of submission button.
If you can see my phone, I don't know if you can see it, but there's like a blue submission thing. Is that it?
Yes, that's it.
Okay,
cool. Yeah, that's it. Cool.
Thank you.
Alrighty, anyone else? All right, cool.
Oh, I have a quick question. So I don't know if it's just like my Canvas that isn't working or anything, but I'm having some issues with like opening up like the just like the modules and then like assignments and stuff.
Only module 1 is open, and I literally just opened it like 5 minutes before lab. So I open them each week. I'll open the next one on Monday of next week, so you'll only see like week by week.
Okay,
and if you ever go ahead.
Oh, I was just gonna say, like, also like in some of my other classes too, like I've just been having some issues with like my Canvas, and then like, you know how you have that like inbox tab on the side where you get like notifications and stuff? Like I don't get any of those unless I go through the app on my phone. So I don't know if,
I have the same issue. Like I'm not getting any notifications for like the professor's announcements. So I think the professors are doing something about that on Canvas. So whenever my supervisor lets me know, but luckily I send all of my like notifications via GroupMe and email. So you won't ever have to deal with like getting the inbox. So cool. And if you ever have like any additional problems, just like email me.
Okay, cool.
The assignment, it says, it looked like yours. It says the assignment was locked August 19th.
Okay, thank you for letting me know. I'll go in and fix those dates.
Okay, cool. Thank you.
For sure. Alrighty. All right, I'll see y'all later. Bye.